Welcome to Radio Azad. This is Aisha with Coffee Connection. Aging beautifully. Is there such a thing? Of course, there is. We are going to find out about it today with our guest, Fasiha Raza. She is a physician assistant and she is from Chic Derm and Aesthetics. We're going to be talking about non invasive treatments for skin rejuvenation. Assalamu alaikum, Fasiha.
Walaikum assalam. Thank you, Aisha, for having me and inviting me for this beautiful conversation. I'm super excited.
I am super excited about it because we're going to learn so much. But
Yes.
first of all, I want to introduce you to our audience. You are the owner and medical provider, a board certified dermatology physician assistant specializing in facial aesthetics and dermatology. So, it really sounds like somebody who knows what they're doing. And she also has a master's of medical science in PA studies. She's the managing director of Chic Derm and Aesthetics, located at 1312 West Exchange Parkway, Suite 2130 in Allen. How lucky you guys are that side of town. And you can even check out her website for all the services and book your service at mydermpa.com. She also is the CEO of Lung and Sleep Healthcare Center, and she mentors and trains different PA students as well. Did I leave out anything? Anything you'd like to add?
No, thank you so much. I also am currently the chair of Dermatology PA Foundation, which is a nonprofit organization. I'm really passionate about their philanthropic work, and basically we contribute to dermatology community through the help of PAs.
So tell our listeners a little bit, what is a PA?
A PA is a physician assistant who is graduated from a PA school specifically, and it's a 2-year master's program where you're taught medicine and you do clinical rotations, and after that you basically pick up a specialty and work in that facility. Yes.
Oh,
Yes.
okay, very
And
nice.
you are a board certified provider. Initially as an internal medicine or a primary care, but then you can definitely step into other fields.
I see. And you
Yes.
decided to step into the field of dermatology. So
Yes.
what made you shift from medicine to dermatology?
So primary care is wonderful. Once you graduate from PA school, it is very important for you to practice all of medicine that you have learned. And I think that encompassing that, treating chronic conditions is key to knowing medicine in general. But over time, my passion always lied in dermatology. And from there, it developed more into aesthetics because I did my rotations and my work in specifically with dermatologists and plastic surgeons. So that's what really got me into this field. I transitioned from primary care to dermatology about 4 years ago, and I cannot be happier.
Well, you're glowing, so you're doing something right.
Thank you. Thank you.
What's the difference for our listeners between dermatology and aesthetics?
Uh, Aesthetics is cosmetic derm, basically. Dermatology is more so treating skin conditions, managing them, and guiding your patients through how to take care of themselves, their skin. Aesthetics is more so talking about your skin in general, making sure that your skin looks radiant, you use the right products, and making it more beautiful.
Mm.
Does it make sense?
Yes, absolutely.
Yes.
I have two questions for you.
Yes.
Why does and how does our skin impact our overall confidence and wellness? Let's start off with that.
I think skin is the biggest, if we think of skin as it's the biggest organ of our body. And skin is superficial presence of anyone appearance. So making sure that your skin looks healthy is key in my opinion. And it does impact your self-esteem and your self-confidence because you can always change your bag, I say, and your clothes and shoes, but the skin is there all the time, 24/7. Making sure that it is hydrated, it looks nice and smooth and free of anything is something that we can always strive for which is not always possible 100% of the time, but I feel that it is very important to kind of focus on that part of our body. Yeah.
You're absolutely right, because as much as we don't want to, agar there is a mark,
Hmm.
a visible mark or a scar on somebody's face, our
Yeah.
eyes automatically go towards that,
Yes, that's true.
right?
And that can actually, sometimes it impacts your self esteem and your confidence. And you are trying to kind of like probably use foundation to hide it or something. You want it to get better, but there's very little you can do with topical creams sometimes. So I feel like it is always a great idea to take care of it or approach it with a professional advice, and making sure that you try to improve it or enhance it if you can. Now, there are some things that you can't really do too much about, but
Mhm.
in any ways, I think it's very important for us to still feel confident whether our skin is clear or not, but certainly do something about it or seek professional advice. Yeah.
Absolutely, and that's very important, especially for our South Asian skin, which is more pigmented, and that's why you need to go to somebody who is well versed with
Hmm.
our kind of skin.
Absolutely.
So, Fasiha, I know aging and skincare, it's a multi-billion-dollar industry,
Industry,
right?
yes.
So, tell us a little bit about the changes that our skin goes through during our lifetime.
So as we are growing older, we are losing collagen over time. So we lose about 1% of collagen every decade of life after 20 years. So making sure that we replenish it by some means is very important. Aging process is very natural process. I mean, we should definitely not try to reverse all of it, because you get beautiful as you grow older. Your features change. Sculpt your face. You can see how it sculpts and how it beautifies in a different way as you grow older, in your 20s in a certain way, 30s and 40s and 50s. Now, maintaining it and making it look even more beautiful is what you can do. So definitely taking care of skin is important. Not only that we lose elastin and collagen, but also skin laxity happens. So over time, we have fat pads in our face that actually start drifting down because we lose collagen under the skin. Now, that collagen that was holding those fat pads up in your face and in certain areas, that shrinks down. And that's how we see sometimes skin laxity. And then we see or notice weight on our nasolabial folds or around the mouth. So skin laxity happens. Sometimes dryness of the skin happens. So skin gets a little dry, a little rough. So all of these changes are very normal. I also see sometimes, pigmentation, hyperpigmentation is big part of aging.
Mhm.
That is because of hormonal changes or sun damage that we have encountered in the past. So making sure that all of those things are definitely manageable, but can happen. But taking care of them at the right time is the key.
Wow, I think you've covered so much of it, and we're going to expand all of
Yes,
these different terms and different things.
exactly.
What does non-invasive skin rejuvenation mean, and how is it different from basic skincare?
Yes. So I make three levels. I say topical treatments, making sure daily skincare is one of your routines is very important. So daily skincare routines, number one. Number two is not choosing non-invasive treatments for your skin. So that is very important. And number three, we can think about more invasive treatments. So after daily skincare, non-invasive treatments come into play when we are thinking about building more collagen or more elastin in the skin. When we are thinking about tightening our skin, say for example, or making our skin a little bit more smoother, improve the texture of the skin, or take care of the pigmentation or anything that will actually smooth out the skin is with a treatment that is not very invasive is called non-invasive. Um, non-invasive treatments also mean that these treatments will have less downtime. So, for example, sometimes we see in aesthetic treatments the downtime, or meaning redness or side effects of those treatments, are prolonged. Non-invasive treatments are those treatments where you just get the treatment done, and next morning, yes, you may have a mild redness or pinkishness, but then within 24 hours, your skin recycles and gets better. So that's where non-invasive treatments come in: minimal side effects, less time to recover, and very enhanced and fast recovery.
So when you say non-invasive versus
Mhm.
invasive, what does that mean?
Yes. So invasive treatments are taking a layer of the skin off, kind of like exfoliating it more aggressively.
Mhm.
Now, non invasive treatments are those that are not targeting the skin cells in such a way that it is causing any skin exfoliation right there and then. Okay.
Mhm. Mhm.
It is basically superficially at a very minimal depth resurfacing the skin. So that's the difference between invasive and non-invasive. Invasive treatments, I will give you an example. For example, would be a CO2 laser resurfacing treatment. So in that case, when we are doing those kind of treatments, the skin is totally resurfaced. So a new layer of the skin comes in
Wow.
after the treatment,
Okay.
which is very, very good treatment in some cases
Mhm.
where we have deep wrinkles, deep hyperpigmentation, something that we texture issues that we have to take care of. So we want to really go dig deep and kind of do those kind of treatments. Non-invasive treatments, on the other hand, start from 0.05 millimeter depth or 0.25 millimeter depth. They go all the way to 4 millimeter depth. So that's where we are talking about very superficial treatment, where it can be done in an outpatient setting. You don't need too much anesthesia or something. And just with topical numbing, you can basically do those kind of treatments in office, quick set, quick results.
Hmm. Can you tell our listeners what are some of the latest, most effective skin rejuvenation treatments available today?
Yes. When I see my patients, I always start with a cosmetic consultation. That's my routine.
Okay.
Um, I like to evaluate their skin and then recommend these treatments to them. And some of the very basic treatments out there are treatments like microneedling. I say when you turn 27,
Mhm.
you definitely need to start now working on your skin collagen and elastin.
Mhm.
Because remember, I mentioned at 20 years of age, after every decade that passes after 20,
Mhm.
you will see reduction in collagen in your skin.
Okay.
Collagen is what holds your skin's integrity together, right? So one of the best treatment, which is the most basic but the most impactful, it is a microneedling treatment, in my opinion.
Okay. And explain a little bit about what that is.
Yes. So microneedling, as the word stands, sometimes people will get a little bit worried about what is micro and why needles, all that stuff. So I see people come in, they're like, oh, I don't like needles at all. I don't
Mm.
want to do microneedling.
Mhm.
So like you asked me, explain it to me a little bit. So very important to know. Yes, these are small, tiny microneedles that go from 0.25 millimeters to 2.5 millimeters depth in the skin. They go up and down horizontally and also in a rotation manner. But what they are essentially doing is going in and out the skin and kind of refreshing the skin in a deeper layer. Okay. Now, that disruption that happens with those microneedles under the skin tells our skin that there is some I am damaged. Our skin or our body feels like something just happened to me and I need to heal now because there is some damage that happened to my skin. Now, it is our natural process where our body is built in such a way that we heal. Okay. And we are so lucky. And what happens is the blood circulation increases when those microneedles go under your skin, and though that blood circulation brings in nutrients or platelets that will start healing the skin right there and then because it just got damaged. Now that process of course, releases growth factors and causes our skin to heal. I give example of, say, for example, you get an injury on your hand, you get a little cut. And what happens is we see that a new skin tissue forms right away.
Mm-hmm.
The bleeding stops, new skin tissue forms, collagen builds, and eventually that scar even goes away. That's the healing process. Imagine the same thing happening with microneedling when you're causing that kind of micro injuries, but then you're healing the skin by building more collagen and skin tissue. Two things happen. One is your skin tightens and new skin cells form. And secondly, you get that skin rejuvenation and nice blood circulation there. So, uh, this treatment is done with a little bit of numbing and 25 minutes of numbing, and then you basically do the treatment very comfortable. A big misconception is that it may be painful.
Mm-hmm.
Absolutely not. Patients say 0 to 10 scale, they say it's 0.
Wow.
So,
And how
twice,
safe is it?
a very safe treatment.
Mhm.
Basically, safety should be, in my opinion, is the priority of any provider, any medical provider, and it is most always. Um, so, safety wise, there is no foreign object that we are injecting in your skin. It's your
Mhm.
own skin cells that we are kind of replenishing, or we are disrupting and making new cells.
Mhm.
So, very safe treatment, no downtime, just mild, maybe redness for 24 hours. And I tell my patients to just stay out of direct sun, and then they should be fine.
Wow. And you've seen great results with this, as you're saying.
Yes. So I recommend my patients, twice a year microneedling is
Mhm.
the key after age 27, just for maintenance.
After age 27. Okay.
Yes, definitely. I think because this is one treatment which is going to rejuvenate your skin from inside out.
Mm.
And so, twice a year, it can be 4 months apart, 6 months apart, however you want to do it.
Mhm.
And then use good products, because now that your skin is healed and refreshed and whole cycle has completed of recycling skin cells, now your skin is going to take the products even better. It's
Mm.
going to absorb the products better.
That's one of the biggest questions that we have is
Yes.
what should be our skincare routine and what products should we be using?
Yes. I always say that there are so many products outside that people get sometimes confused.
Mhm.
But I think having a good facial cleanser, which should be tailored to or needed by your skin, or so guided by your profession, medical doctor, meaning, say, if you have acne prone skin or if you have oily skin, it's important to choose a product that has a little bit of salicylic acid or something, and a little bit of exfoliant, which is going to help minimize that acne breakout. Now, secondly, it is important, if you have sensitive skin, to use a sensitive gentle cleanser for your skin. So definitely a good customized facial cleanser for you.
Mhm.
Number two, a good hydrating moisturizer. Now, some people, again, I'm going to go between acne prone skin patients and also patients with normal skin or oily skin. So, thinking about a good moisturizer is a patient who has acne, they need to use an oil free moisturizer. So, oil free because they have genetically sticky pores. So, if you have genetically sticky pores, meaning you have more oil in your oil glands and it is causing acne, then we want to make sure we don't use more oil on it.
Mm.
Does it make
Okay. Makes
sense?
sense. Yeah.
So there are so many companies out there that make oil-free moisturizers, like
Mhm.
Cetaphil, CeraVe, all of those companies, La Roche-Posay. You can pick any that you like.
Really? So
Yeah.
you can go over the counter. You don't need
Yes.
a professional
No
grade.
medical product, medical grade product is needed. It's just oil-free moisturizer. It can be bought from any store,
Mhm.
even online. Amazon has everything nowadays.
Okay. So cleanser, moisturizer.
Yes, a good. And then if you have dry skin, for example,
Mhm.
then I say use a more hydrating moisturizer, right? So making sure that you take care of your skin and hydrate it is important because we don't want fine lines or wrinkles to happen.
Mm.
When your skin is dry, that's when most of the fine lines you're going to notice, and your skin is going to get even deeper lines over time if it stays dry for too long.
Oh.
So making sure a rich hydrating moisturizer
Mhm.
after face wash is used every night, that is very important. There are some HA serums. A lot of people use hyaluronic acid serums at nighttime. That is also totally fine to use.
Mhm,
Yes.
mhm. What about things like retinol,
Mhm.
your toners, your serums?
Yes, that's a great question. That's where I was thinking about talking that retinol is pretty much present in all night creams these days.
Okay.
And it is a thought of a lot of in the industry and also patients. It is used for reduction of fine lines and wrinkles, and it's thought to be an anti-aging product,
Mhm.
which is absolutely true, but not for everyone.
Ah, okay.
Yes. So I suggest that you use if your skin is on the dry side, I would not want you to use too much of retinol.
Mhm.
I would rather have you use more hydration and keep your skin hydrated, because that's going to prevent your fine lines and wrinkles, rather than retinol, which is a vitamin A derivative, and also the function of retinol is to exfoliate your skin.
Mhm.
So a person who has, say, textural issues and their skin is normal, they are a good candidate to use retinol. Um, Use it, but do not overuse it. So
Okay.
both things are important, because if we use it for a prolonged time, for years, that can again resurface your skin a little bit too much and make it again on the dry side. So we want to make sure that there is always a balance between how we use it. So great anti-aging product in essence, but use it wisely and only based on your skin needs, but you don't use it for a prolonged period of time.
So what I hear you saying is less is more,
That's true. That's
right?
true.
As
And choosing the right product is
choosing
important.
the right products, absolutely.
Yes.
I have a whole question on sunscreen and sun care,
Hmm.
but let's go back to the skin rejuvenation treatment. So you
Hmm.
talked about microneedling.
Hmm.
What other treatments are there?
Yes. So there are many other treatments that are used. RF microneedling is another treatment. It's very popular. Radio frequency is used in combination with microneedling for more so skin tightening. So it is more of a skin tightening and or acne scar revision treatment, or a scar revision treatment, because again, this uses two modalities now: heat from radio frequency and then microneedling depth to cause that disruption or production of new skin cells.
Mhm.
That is a great treatment in my opinion. There has been a lot of talk about Botox being used as preventative therapy and also for corrective therapy.
Mhm.
I know it's very popular. It gives you instant results. You look beautiful and fresh. Again, knowing if you are the right candidate for that treatment, of course, solely based on your doctor's recommendation. But Botox is used for fine lines and wrinkles prevention in an early age, so that those contractions that happen in our muscles, those are minimized, so those lines don't get deeper over time. So
Mm.
Botox can be used as a preventative therapy.
And how often do you need to get Botox done?
So usually it depends on patients' facial movements and their ability to form lines. So meaning, in a average case scenario, it would be every 4 months you will be getting a touch up, but you can only get it once a year too if you have very minimal lines.
Mhm.
So meaning that it would be totally based on your facial muscle movements, and especially like I'm talking about forehead contraction or glabella. or crow's feet, like around the eyes. I think the treatment around the eyes with Botox make you look very fresh. And I know there is a little bit of hesitancy from a lot of people using a medication and being injected in their skin, and also a concern about looking artificial
Wouldn't.
or frozen. So I think that it is it's a phenomenal product. I think trying it is a good idea only if you qualify for that treatment with professional advice. But definitely, it can be used as a prevention for minimizing your fine lines and wrinkles.
But once you get it, then it only lasts for how long? And then you need to get it for life?
Yes. So how it goes is once you get the treatment, the product is going to last for about 4 months, or the results are going to last about 4 months. It is then digested by the body. So
Okay.
you come back to baseline. There is a misconception that if you get Botox, then you would have to get it every 4 months. That's not the case. It's only based on your desire to continue if you want to, because again, once this the medication is in your system, it is going to be digested by the body, and it just finishes its cycle, and that's it. So you come back to baseline where your original facial movements were, for example. um, so you do not have to get it for life, but you will look so nice and fresh that you would want to get it
Mm.
every 4 months.
Okay.
So it is, in some ways, a lot of patients they love the results and they want to continue. But there is no fear about that it will make your skin more lax, or your lines would appear more after the treatment. That's not correct. That's not a correct information. Yes.
Okay. We see a lot of people getting fillers, lip
Yes.
fillers, cheek fillers, lip fillers to get that perfect pout.
Yes.
Talk to me a little bit about that.
Yes, dermal fillers are beautiful products. They are different types, and the one that I particularly like is hyaluronic acid HA fillers. Why I like those fillers are because they are more gel-like and they are digested by the body again. So it's not there for a long time. So life of a filler is about 12 months to 18 months.
Okay.
Okay, once treated. Now, over time, with your exercise and facial exercise and all that stuff, or just over time, the body digests it. They are beautiful products when they are used correctly, in the correct area, in the right amount, and where it is needed. So I use them for facial contouring. I use them for facelifts for patients. It's called a non-invasive facelift with liquid fillers. And also, lip fillers are very popular. Like, people like to enhance their lips and add some volume. As we age, we see sometimes there are some lines on the lips, or like they're getting a little dry on the drier side. We want to hydrate them. Now, lip balms are great, but sometimes you want just a little bit more. So that's where the filler comes in.
Got it. Got it. Fasiya, what are the most common concerns that people come to you with, and how are they different in the 30s, 40s, 50s, and up?
Yes. So I have a wide range of patients who come to me, starting from teenagers with acne. And then I have patients who come in for acne scarring because they had it in puberty. And then they're in their 20s. And then I have 30-year-olds, they come in for more so now their skin is a little bit kind of like getting a little lax and they need to do something about it. And then 40, I see more fine lines and wrinkles, a little bit of more filler consultations. And then after that, hyperpigmentation comes into picture. So in each stage of age, I would say there are certain more common things that are visible. So acne scar revision is one of the most commonly seen treatment or that I do in my practice. And then also, of course, fine line wrinkles and fillers and stuff. But in South Asian community, in our ethnicity, I feel that hyperpigmentation and melasma is number one.
Hmm.
And number two is under eye,
Bags.
yeah, dark
Like dark
circles,
circles.
and maybe a little bit of puffiness that is present in some cases and not in some cases. So
So
that's the consultation I do.
is it reversible? Dark circles and melasma?
So great question. Yes, it is reversible with the proper treatment.
Okay.
And I feel that, of course, getting a consultation and using the right treatment is key when you are treating melasma. So most of my patients who come in, I like to educate them first. I say that, okay, how long this pigmentation has been there, and how long you have been seeing melasma, and have you done anything about it? So, do you know like the creams that are used for hyperpigmentations, like hydroquinone and other things, are used for melasma treatment? They work great for some time, but then unfortunately the pigmentation comes back,
Hmm.
and we people struggle with that, and they go back and forth, and they use retinol and vitamin C, and then hydroquinone, bleaching agent, something like that. It is a stubborn beast. I would say that. Yes. But in my opinion, now with the advancements in medical technology, we have seen that treatments like laser resurfacing, non-invasive laser resurfacing, like Thelium 1927 laser by Moxie, which is a Cyton brand, is beautiful treatment for patients who have sunspots or hyperpigmentation or
Mm-hmm.
melasma even.
Mm-hmm.
Yeah.
Good to know. That is, and I know it's a real struggle out there,
Yes.
with a lot of different people.
Yes.
Fazia, how important is sun protection, especially for people with our darker skin tones?
Mhm. Very, very important. Actually, it is important for all skin types,
Mm-hmm.
right? I say that most of us have kids. We want to make sure when they're going on a soccer game or they are, out in the swimming pool, we want to make sure they have sunscreen on.
Mm-hmm.
And sunscreen, comes in different flavors and different types and different, modalities. But I say SPF 50
Mm-hmm.
is at least the base minimum that we should all be using, and using at an early age rather than choosing it later. Now, there is a little bit of, some people say that I don't like the feel of sunscreen, how it feels on my skin and doesn't. So I always say explore, try different products and see which one you like better. There are a few suggestions that I always have
Mm-hmm.
for my patients. But it's extremely important because when the sun rays hit your skin oxidizes and it causes sun damage and it makes you age. So for anti-aging prevention, we should definitely use sunscreen on daily basis.
And how often should we be reapplying it?
Yes, I would say every 2 hours. If you're outside and you're going to stay there for about 6 hours, so reapplication every 2 hours is important.
Mm-hmm.
Yes, before you head out, and then 2 hours into it, then reapply.
There is a misconception that sunscreen actually causes cancer. Have you heard that?
I would say always consult your physician or doctor about any particular product. Not all sunscreens do that.
Okay.
Yes.
Okay. Okay. Excellent.
Yes.
What advice would you give somebody who wants to embark on this skin rejuvenation journey? They look at themselves in the mirror and they're like, oh, line here, crow's
Mhm.
feet. I have this spot, this spot. What would you tell them, and how can you help?
Yes. I would say instead of going on Instagram or Facebook and looking at those influencers and
Mhm.
seeing, what they are recommending, I would say schedule your appointment
Mhm.
with someone who is certified, qualified to take a look at your skin and guide you in the right direction. You would not believe how many times I have had patients from our South Asian skin types that they would come to me and they have tried chemical peels, they have tried IPL, they have tried different treatments, which have actually not to their benefit. It has not done good to their skin, and now they're scared.
Mhm.
So I would say consultation should be your number one way of getting those questions answered, and then come over and then speak to a provider and then tell them, this is what I see. What is the most non-invasive way I can take care of it?
Mm.
Period.
Okay.
And based on their recommendation, then you also decide and make a plan. Okay, I like this idea that I want to start with this treatment first and then go forward slowly but surely and keep on track.
Mm-hmm.
You know,
Okay. Okay.
yes.
As you're talking, so many questions come to my mind. Now, you provide free cosmetic consultations?
Yes. I always do that because I feel that it is my patient's right to ask me any questions first.
Mm-hmm.
And it's my privilege to actually take a look at their skin, evaluate their skin, and give them the advice and treatment plan beforehand before they sign up for any treatment.
Excellent, excellent.
Yes.
A lot of us, as desis, we love going to these salons and getting a little nice facial and massage. How effective are those?
So, facials are always good, in my opinion.
Okay.
If you really want a pampering one, the steam ones with all the massage and everything is going to make you feel real good, and open your pores and kind of extract and all that stuff. I think facials in general are perfect, and you should be doing it once a month.
Once a month.
Yes.
Okay.
The reason I say that is because you see, when we go out, environment, dust and pollution, can cause your pores to clog. Now, secondly, you're using makeup or
Mhm.
sunscreen, your skin after some time is not able to breathe as well. So it's very important that we cleanse our skin nicely and let it breathe, and then basically take our products and reapply, and that's how your skin will feel, actually receive those products better and also feel great and smooth.
Mhm.
um, Between facials, I say there are different types of facials.
Mhm.
And my personal favorite is hydrofacial, because hydrofacial uses this vortex technology where it actually extracts and cleanse and infuse your skin together.
Mhm.
So it has multiple layers to it, meaning it has a little bit of peel, a little bit of extraction, a bit of antioxidant. So, and then in the end you can use a serum. So I feel like some facials will last longer than the others.
Mhm.
So pick a one that is going to last you longer. At least it should give you 1 month of great skin, and then after that you just repeat the process.
Okay, that's very good to know. And I got my first hydrofacial done, and it was wonderful. So I'm excited about trying one at Chic Derm and Aesthetics. One thing that we didn't talk about was chemical peels.
Yes.
Shed some light on that. As far as chemical peels are concerned, I remember, from my experience, very long time ago, I had gone to somebody for a chemical peel. Somebody had given me a certificate, and I was like, oh, okay, I'll use it. And I ended up with burns on my face,
Oh,
right?
that's sad.
Because they did not know about
Mhm.
how to deal with somebody with our South Asian pigmented skin.
Yes.
So tell me a little bit about that.
Yes. So chemical peels have been very popular for a long time. And they were initially used, like, say, 20 years ago, for exfoliation, skin exfoliation. And the concept was that when we have a problem, a textural issue, fine lines, wrinkles, pigmentation, we can just use a chemical to get rid of the top layer of the skin, and it will exfoliate or peel, and then the new skin cells will come underneath, and that will kind of rejuvenate the whole skin.
Mhm.
However, we did not realize at that time that by doing that, we are essentially, using a product that can be too strong for one type of skin, or it will not be good fit for all. So, since chemical peels come in different grades, it
Mhm.
comes in a mild peel, a moderate, and a very strong peel. It is used for different, skin conditions. It's very important, like you said, to know which chemical peel would be good for this skin type. So having that knowledge of skin type. There are 6 types of skin types: skin type 1, 2, 3, 4, 5, 6.
Mm-hmm.
Having that knowledge for a provider is very, very important, because if you use a product which is not good for one certain skin type, it can cause side effects, just like you mentioned, hyperpigmentation.
Mm-hmm.
So the process of chemical peel is that it actually absorbs in the skin, causes, of course, the recycling of the skin cells, but also causes a lot of inflammation.
Oh,
You might have noticed that when you got the peel, probably, your skin was red for some time,
yes.
and then it peeled for a few
Peeled.
days, and
Yeah.
then it was a whole process of 7, 10 days or something like that. That inflammation sometimes can cause post-inflammatory hyperpigmentation in darker skin tones.
Mm.
And it is unfortunate that when it happens, that sometimes a very strong peel is used to give the client a very good result or quick result, not knowing that it can harm their skin.
Mm-hmm.
So, in my opinion, in my office, I don't do chemical peels at
Okay.
all.
Okay.
And this is one of the reasons why. And I instead use more advanced treatments. With time, things have improved so much. The laser therapy, the laser resurfacing uses no product, but it's just recycling of your skin. So I always use Moxie laser resurfacing for, like I said, for melasma, pigmentation, fine line wrinkles, texture. That is much more safer than compared to chemical peels now that can have side effects, and the other treatment doesn't have any.
Okay, excellent information.
Yes.
People always want to know about things that they can do at home.
Yeah.
What would be some effective daily habits that you can recommend to our listeners?
So, daily habits, exactly like I said earlier, making sure that you cleanse your face in the morning and at night with a good facial cleanser.
Mm-hmm.
Double cleanse sometimes if you're wearing makeup,
Okay.
especially when you're going to weddings and getting ready and all that. Make sure that you have a good skin polish, for example. I always recommend to some of my patients having a very nice skin polish at home for those days when you really want to clean your skin.
Mm-hmm.
And then from there, of course, hydration, SPF, and making sure you're using a vitamin C in the morning, which is also another antioxidant, and it helps protect your skin from some damage.
Oh.
Those are the basic elements. Another product or skincare that I advise for my patient, it would be using skin probiotics.
Okay.
And skin probiotics are from a company called BioJuve, which I really like. And they actually this product actually helps tighten the skin and also rejuvenates the skin in total, like in all, rather than, working on pigmentation or under eye or certain areas. It's kind of like full face rejuvenation with the probiotic serum.
If you eat probiotics, does it help or can it give
Y-
the same results?
Definitely. I mean, eating would help, but I always say that if you're taking, say, collagen supplements or taking probiotics, that does help to a minimal level, because again, you're taking that capsule and it's going throughout your body. So everywhere, its impact has to be distributed
Mm-hmm.
throughout.
Mm-hmm.
But when you're using something topical and exactly in the right spot where you need the help, it actually makes the most improvement, in my opinion. So definitely keep up with the supplements, but then targeted approach,
Mm-hmm.
meaning targeted treatment for each area, would be best, in my opinion.
Okay,
Yes.
excellent. Goodness. We
A lot of information.
a lot of a lot of great information, because it's a field that we don't know too much about, and like you're saying, we're getting our information from Instagram and TikTok, and through our friends, and everybody has a different need, right?
That's true.
So it's important to go to somebody who knows and can customize things for you. We
Absolutely.
have a question from a listener, and we'll open the phone lines now as well.
Mhm.
Due to weight loss, skin gets saggy. In that case, what can be done?
Yes, that's a great question. And I'm very, very happy that you asked. So, yes, when you lose weight, dramatically, and the skin kind of like sags a little bit, because now wherever there was subcutaneous fat or some tissue was there, it has gone.
Mhm.
We need to tighten that skin tissue. So we need to think of something that is going to do that for you.
Mhm.
Number one, I suggest that doing a mechanical treatment, meaning like microneedling, RF microneedling, something like that, that is going to initiate that skin cell, those skin cells to kind of like start working at tightening, building new collagen and elastin. Something like that would really help in this case. Now, you may need up to 2, 3 treatments, but that would be your first go to, in my opinion, if you were to do that. Secondly, like I mentioned, skin probiotics. Start
Mhm.
using them. Use them for a good 6 to 7 months while you're getting those microneedling treatments
Is
done.
that a cream?
Yes.
Okay.
Skin probiotics is a skincare serum,
Okay,
basically.
serum.
Yes.
Okay.
That you use every night and after you wash your face. And that actually, there are several studies by that product line that shows that the skin really experiences tightening, fine line wrinkles go away, and skin is more hydrated and fresh. So I think those are the two things that I would do if
Mhm.
you lose weight and you are seeing some skin laxity.
Okay. 972-501-9390 is the studio number. If you have a question, I know Fasiha has really given us so much great information. Fasiha, how do people get in touch with you?
They can go to our website. It's www.mydermpa.com, and we have a booking link there. Schedule your cosmetic consultation once you click on that button, and come in and see me. And I would love to talk to you and guide you. I always say that you are there to find out more or get educated, not to get a treatment. So you not for the treatment. So you can always decide later what you would like to do, but at least I'm there to help you out. Another good way to reach out to us would be through our Instagram. It is at Chic Derm.
Mhm.
Usually that way, I post a lot of educational videos there, so that I can be in touch with everyone.
Excellent. And they're located at 1312 West Exchange Parkway, Suite 2130 in Allen. And the phone number is 469-466-2727. Let's see. We have a caller. Radio Azad, you're on the air.
Gee, Aisha and Dr. Fazia, great show, and you covered most of everything, I think.
Thank you.
So, and Aisha, I think she prepared very good questions. And so, mostly when we are into the hum of life, most of the time, we forget ourselves, and especially our skins. I would love to come to Dallas, but I'll have to fly as I live in Minnesota.
It will be worth it. It will be worth it. Yeah. Great.
So yes, great, tips. But tell me one thing. Most of us, we women, have so many creams and serums and everything at home. Uh, does it make big difference? Other than you mentioned, I was listening. But other than that, you eat healthy and you live healthy. That makes more difference on the skin than applying all kinds of creams and eating unhealthy stuff.
All right.
Yes.
Thank you for your question.
Absolutely. Great question. Thanks for calling in. You absolutely hit the nail on head. Taking care of your skin does not mean that you're using tons of creams every single day and you have a 12-step routine. I would say diet, exercise, and healthy eating habits is key. So making sure that you're keeping up with your fruits and veggies, and also making sure that you exercise.
Mhm.
That is something that is very, very important. It has a great impact on your skin health. Now, definitely, I'm not in favor of using tons of products or purchasing a lot of products and spending money on those. I feel you should stick to only 3 to 4 at the most products. That those are going to be your key to better skin, and never invest in too much. Although I would highly suggest choosing a more one of the medical grade products which is being researched in the industry and has shown its results would be a better choice. So I would say invest wisely and choose less.
Good advice. Great. Wonderful. One of the questions that has come in is about dermaplaning.
Yes.
Tell
Such
us
great
about
questions. Yes. So dermaplaning is used to get rid of vellus hair, which is a very fine hair on our skin, especially used for the face. And it is considered also as an exfoliating treatment for the skin.
Mhm.
Sometimes it has been, people think of it that if I do dermaplaning, it is going to make my skin smoother. The skin becomes smooth because that hair that was on your face or a small vellus hair is now gone and it feels smoother. However, dermaplaning is not doing any kind of superficial skin exfoliation. So difference between that is, yes, it's a very superficial treatment. It's a great treatment to smooth your skin, but it is not a treatment that is going to resurface your skin, just like if microneedling would do, or say a laser resurfacing would do.
Got it.
Yeah.
Mhm.
It is safe. Always make sure that you change your dermaplane after every use. Do not use the same blade every time. So making sure that it's sanitary, done appropriately, is very important.
Okay. And one thing that you do at the clinic, med spa, is laser hair removal, right?
Yes, absolutely.
Okay.
So we recently ventured into it because a lot of my patients, I see them, I do skin consultations. So
Mhm.
they would ask me, where should I go for my laser hair removal treatment? Because my skin, which device should I look for? What, practice should I go to? And so I would guide them, okay, find this device, this thing, because not all laser hair removals are good for our skin type. So making sure a safe treatment has been done, because a lot of people get hyperpigmentation after laser hair removal.
Mhm.
So that's when I decided that I have to, we have to get a device ourselves. And I would like to help my patients and take care of them myself so they feel safe. And, their treatment results are also good.
Okay, excellent. Let's take a caller. Radio Azad, you're on the air.
Assalamu alaikum, Aisha and Fasiha.
Walaikum assalam.
Such excellent program. A complete information in under 1 hour. इतना अच्छे से cover किया. And Aisha, what great questions you put in.
Thank you. Thank
So
you.
you prepare, वो बाद में पूछती हूँ आपसे. I mean, you are so well versed in asking questions to all the professionals who come for the interview and all. And thank you, Fasiha Raza, for such excellent expertise and giving it under 60 minutes. So
Thank you.
I am overstepped. Excuse
Well,
me?
well, the questions I have to say were collaborative, so I cannot take the credit for that.
What informative, कोई पूरे answer कर दिए आप लोगों ने इतने अच्छे से, and keeping the person ready for a consultation,
Mhm.
So what what advice do you give for aging skin 70 plus? And is niacinamide,
Mhm.
vitamin C, or collagen better for age 70 and plus?
Okay, great question.
And what is the benefit of using creams which have niacinamide?
Mhm.
Vitamin C, I know is for brightening, but is it suitable for age 70 plus? Thank you so much. Looking forward to your answer. Okay, thank you.
Thank you, SKFG. So niacinamide, even I'm stumbling over it.
Niacinamide.
Vitamin C, yes,
Mhm.
vitamin C and collagen.
Yes. So specifically for age 70 and plus, I would definitely recommend these vitamins and collagen and niacinamide, because yes, they are going to help with anti-aging a little bit. But in my opinion, again, I would go back to my initial conversation. Choosing a mechanical treatment which causes the skin disruption and makes it heal would be a better choice after at around age 70.
Mhm.
Now, Niacinamide is a great component in vitamin C. Definitely, like I said, that in the morning, it's a great antioxidant. It prevents aging skin and also protects the skin from sun damage. Collagen, however, comes in capsules, powders, and all different forms. Definitely worth taking, but I at sometimes feel that they are not as beneficial as some other options available. And again, collagen dispersed throughout your body with powders and stuff like that. Yes, you will get that, but it is not going to impact the most on your face or say your neck and your the areas that you really want to improve, because we do have good collagen on our legs always and arms and stuff, and abdomen. So yes, I think these are great products and continue to use them, but do seek advice from medical providers.
Excellent. Thank you so much, Fasiha. It was a great hour. And you really covered a whole gamut. We're looking forward to our next segment. We're going to be talking about beauty trends, facts, and myths. So we'll get a lot of questions answered at that time. Again, Fasiha Raza is the medical director at Chic Derm and Aesthetics, 1312 West Exchange Parkway, Suite 2130 in Allen. Phone number 469-466-2727. And the website where you can go for more information and to book your appointment is mydermpa.com. mydermpa.com.